12 early signs of liver cirrhosis. The dangerous illness known as cirrhosis causes scar tissue to replace good liver tissue, which eventually compromises liver function. The early indicators of liver cirrhosis are very often overlooked, which may put off diagnosis and treatment. But fear not, because today we'll look at 12 warning indications that you or your loved ones might be having liver problems. We will also be looking at some remedies on how to prevent it, but before we begin, drop us a like button, as it will help us go a long way in providing more helpful natural remedies. Let's unpack some telltale signs of cirrhosis, which you can look out for if you notice a few of these signs. Sign number 1, fatigue and weakness. Feeling weak and exhausted for no apparent reason. This is one of the first symptoms of liver cirrhosis. The liver struggles to carry out its critical tasks, such as removing toxins from the blood and making proteins, as it sustains more and more damage. Even after getting enough sleep, this can leave you feeling exhausted and depleted. Sign number 2, loss of appetite. Another typical early indicator of liver cirrhosis is appetite reduction, or feeling full even after consuming little meals. Your body's capacity to metabolize foods and control appetite may be impacted by a drop in liver function, which may result in a decreased appetite and possible weight loss. Sign number 3, nausea and vomiting. Moreover, digestive symptoms like nausea and vomiting might be brought on by liver cirrhosis. The accumulation of toxins in the bloodstream as a result of liver damage can irritate the lining of the stomach, causing nausea and the want to throw up. Frequent or prolonged bouts of nausea and vomiting should be evaluated further by a medical practitioner. Sign number 4, abdominal pain and swelling. You may develop stomach pain and swelling as liver cirrhosis worsens. This is frequently the result of ascites, a disease in which fluid builds up in the belly. You can experience pain and a heavy feeling in your abdomen as a result of the swelling, and your clothes might feel tighter around your waist. Sign number 5, jaundice. When the liver is unable to filter bilirubin, a waste product is created during the breakdown of red blood cells. This can lead to jaundice. Jaundice is a yellowish coloring of the skin and whites of the eyes caused by the damaged liver's inability to remove bilirubin from the bloodstream, which is one of the symptoms of liver cirrhosis. Sign number 6, dark urine. Another early indicator of liver cirrhosis is dark urine, which is frequently accompanied by light-colored feces. A bilirubin accumulation in the bloodstream can result in dark yellow or brownish urine, while the liver's decreased ability to produce bile might cause light-colored or clay-colored feces. Sign number 7, itchy skin. Pruritus, or itching, is a possible side effect of liver cirrhosis caused by an accumulation of bile salts in the blood. These bile salts have the tendency to build up in the skin, causing itching and irritation that can be especially noticeable in the hands and feet. Itching can be made worse by scratching the afflicted areas, which can lead to infections or skin sores. Sign number 8, easy bruising and bleeding. Hepatic impairment may impact coagulation factors, making bleeding and bruises more likely. When you are hurt, your liver creates clotting factors that aid in stopping the bleeding. The liver may not produce enough of these clotting factors in liver cirrhosis, which increases the risk of bruising from small bumps or cuts and heavy bleeding from wounds or traumas. Sign number 9, swollen legs and ankles. Liver cirrhosis patients may experience edema, or swelling of the legs and ankles as a result of fluid retention brought on by compromised liver function. It may be uncomfortable to walk or wear shoes when there is an accumulation of fluid in the lower extremities. Sign number 10, spider angiomas. Ever heard of spider angiomas? They are tiny red blood vessels that resemble spider webs or legs that show up on the skin's surface. These skin lesions, which result from altered blood flow and circulation brought on by liver disease, are a typical indicator of liver cirrhosis. Usually found on the face, shoulders, or chest, spider angiomas can also be associated with other skin abnormalities, including palmar erythema, or reddening of the palms. Sign number 11, confusion and cognitive impairment. Hepatic encephalopathy A disorder caused by impaired cognitive function as a result of liver cirrhosis can cause disorientation, forgetfulness, and trouble focusing. Toxins can impede liver function and cause toxins to build up in the bloodstream, which can disrupt mental state and brain function. You must get medical help right away if you or a loved one exhibits changes in behavior or thought processes. Sign number 12, impotence and breast enlargement. Liver cirrhosis in men can result in hormonal abnormalities that produce gynecomastia, or enlarged breasts, and impotence, or erectile dysfunction. Hormone fluctuations, specifically reduced testosterone and elevated estrogen, can impact secondary sexual traits and sexual function. Similarly, liver cirrhosis may cause women to have irregular menstruation cycles or other hormonal disorders. Now that you know about the early signs, it is crucial that you prevent in any way you can. So here are 9 best natural ways to prevent and reduce the risk for liver cirrhosis. Number 1. Limit alcohol consumption. Alcohol abuse is one of the main factors contributing to liver cirrhosis. It's important to restrict alcohol use or avoid alcohol completely to preserve the health of your liver. The recommended daily limit for men is 2 standard drinks, and for women, it is 1 standard drink. Refrain from excessive drinking, and if you are addicted to alcohol, there are a number of ways you can get help, like alcohol cessation clinics. Number 2. Maintain a healthy weight. Being overweight or obese raises the risk of fatty liver disease, which eventually leads to liver cirrhosis. Maintaining a healthy weight and avoiding liver fat formation can be achieved by implementing a diet high in fruits, vegetables, whole grains, and lean proteins. Exercise on a regular basis is also crucial for maintaining a healthy weight and liver. Number 3. Practice safe sex and avoid sharing needles. Viral infections such as hepatitis B and C can damage and inflame the liver, eventually resulting in cirrhosis. Prevent the spread of hepatitis by wearing condoms during sexual activity and refraining from sharing needles or other drug paraphernalia. Consider having a hepatitis B and C test or vaccination if you are at risk of contracting the disease. Number 4. Avoid unnecessary medications and supplements. Over-the-counter medications, herbal supplements, and some prescriptions can be hazardous to the liver and aggravate liver impairment. When taking medication, always heed the advice of your healthcare practitioner and refrain from self-medicating with superfluous pills or supplements. Supplements and herbal treatments might not have undergone extensive safety testing, so proceed with caution. Number 5. Practice good hygiene and food safety. The virus that causes hepatitis A is spread by tainted food and drinks. Wash your hands properly both before and after using the loo as a sign of good hygiene. To avoid contracting a foodborne illness, make sure that food is cooked and stored correctly. Think about receiving a vaccination if you plan to go to areas where hepatitis A is highly prevalent. Number 6. Manage chronic conditions. Liver cirrhosis risk factors include high blood pressure, high cholesterol, and diabetes, among other chronic illnesses. Make lifestyle changes. Take your medicine as prescribed and schedule routine checkups with your doctor to help manage these diseases. Your liver's health can be safeguarded by keeping chronic illnesses under ideal management. Number 7. Get vaccinated against hepatitis. Both hepatitis A and hepatitis B, 2 viral illnesses that can result in liver cirrhosis, have vaccines available. Consider being vaccinated to lower your chance of infection if you are not immune to hepatitis A or B. Those who are more vulnerable to infections, such as healthcare professionals, visitors to endemic regions, and those with specific medical conditions, should get vaccinated to reduce the risks of this disease. Number 8. Avoid environmental toxins. Exposure to industrial chemicals, pesticides, heavy metals, and other environmental contaminants can cause liver damage and raise the chance of developing cirrhosis. Take preventative measures to reduce your exposure to pollutants at home and at work. When working in dangerous locations or handling chemicals, abide by safety regulations. Number 9. Regular medical checkups. Frequent checkups with a doctor can aid in tracking liver function and identifying early indicators of liver disease. Talk to your healthcare practitioner about screening alternatives if you have any risk factors for liver disease, such as a history of alcohol abuse, obesity, or viral hepatitis. Early identification and treatment can stop liver disease from developing into cirrhosis. By incorporating these preventive measures into your lifestyle, you can reduce your risk of developing liver cirrhosis and protect your liver health for years to come. Remember that prevention is key, and taking proactive steps to maintain a healthy liver can significantly impact your overall well-being. If you have concerns about your liver health or risk factors for liver disease, consult with a healthcare provider for personalized guidance and recommendations. If you have enjoyed this video and found this helpful, feel free to share it with a friend or loved one. If you'd like to learn more about overlooked diseases and natural remedies, our whole YouTube channel is dedicated to these. Subscribe to our channel and press the bell icon to make sure you don't miss any of our future videos. Until then, we wish you good health.